We have Dr. Steve Mulholland here in the studio. He is, among other things, a plastic surgeon. I don't want to pigeonhole you. You do other things.
It is. That's correct, Dave. That plastic surgery now is non-invasive and invasive. So the consumer, the potential patient, can look great, but not have to worry about the risks traditionally associated with surgery. So with the advent of lasers and injectables and skin care, there's really something for everybody that wants to participate in looking their best beyond what you and I do, which is basically Irish Spring.
Yeah, and Prel.
Yes, yeah. So there's guys and there's gals, and we do different things. But
luckily, I am on the radio, but I'm married to somebody who is a TV person, and this question comes up: and I've seen it done really tastefully, so that you would never even know. And then every once in a while, like I've got a neighbor. One etiquette question I posed the other night in the show is like, if something has happened that's really obvious, do you comment on it? You know?
I think that...
Do you say, hey, you're looking great. I see you've had some work done. Or do you just keep your mouth shut?
I think that discretion is the better part of valor.
Yeah, right.
And I would just, there are some overdone scenarios and situations, and it's probably the last thing that person wants to hear because they already feel bad about looking odd. And
people get that lion face. The only analogy I could draw would be to tattoos. It's like, oh my God, I really regret this, but now I've got to go back to the person who made this thing that I regret in order to somehow correct it. And that I would imagine when it's your face would be all the more fraught.
It's tough to say. I slipped and fell on a scalpel. But tattoo removal, we have wonderful lasers to remove tattoos. So when you have a faux pas, a drunken misadventure in Las Vegas and end up with God knows what on your body, tattoo removal is the #1 fastest growing procedure in North America. In fact, 1 in 5 people now have a tattoo. And for the first time, women outnumber men. So I have
more women have tattoos than men.
The men in the segment of 25 to 45 years old, women are 69% of all tattoos are now women.
Oh, that's interesting. Well, I got one tattoo. This is a little bit off topic. I got one tattoo, and then I got one that I really regretted. And I went into a place, and I said, I got to get this removed. And they said, well, okay, your skin's going to bubble up like bacon. And it's going to be really expensive, and it's going to be painful, and you're going to have to come back numerous times. Or we could give you a cover-up. And that's what set me off. Now I'm covered.
Well, tattoos, it's not just about removal. Some of the some of the happiest clients I have are what I call transitioners. They love their tattoo. They celebrate it. It's part of them. But they want this color to go here. They want that part of it to go there. So we transition a lot of tattoos rather than remove them. And one of the biggest referral sources we have are tattoo parlors, where they send clients to transition or over ink, remove some ink to add some more ink to enhance the tattoo. So tattoos aren't bad. I mean, I've got 6 kids, and I told them all 3 things. Don't get pregnant, or don't get someone pregnant. Don't get a communicable disease, and don't get a tattoo. And
did they listen?
2 out of 3 isn't bad.
So people these days, I understand that there's somebody who spent $26,000 to look like David Beckham. Is that a big thing now that people are like saying, I want to look like that celebrity? And is it that simple? Can you go in and can you, as you say, slip and fall on a scalpel and suddenly look like David Beckham? Or, do you have to spend a little time in the gym?
I think that, #1, it's extraordinarily ill-advised to try and change your entire look to be someone else. It really suggests you're not an appropriate candidate because you're not healthy with yourself, your id and your super id. You have to be a healthy person that just wants to look maybe a little, you've tried the gym, you've tried exercise. I mean, David Beckham did the right things. He picked the right parents. He's got extraordinary gene code. And the clip I saw, $26,000, he looked like Kim Jong-un of North Korea, not like David Beckham. And so I think it's not a good idea to try to look like someone else, just to be the best person you can be. Cosmetic enhancement is not for everybody, but we live in an extremely vain culture where we're all judged by the cover of the book, except maybe on radio. And, if the book doesn't look good, no one's going to read you. And it's just a sad fact.
Do you do a bit of psychological screening when somebody comes in, say, like, maybe you're doing this for the wrong reasons?
That's very important. I think plastic surgeons, are some of the best 10-minute psychiatrists out there. We have to diagnose very quickly. Are you appropriate? Are you realistic? Are you suffering from psychological disturbances? Are you depressed? Are you trying to solve depression through surgery? Do you have body dysmorphic syndrome? So, yeah, you have to really dig deeply into the candidacy of the patient. And most plastic surgeons will say no way more often than they'll say yes.
So somebody will come in and say, I want this, that, or the other. And you'll say, no, I won't do that because I don't feel like you're getting it done for the right reasons.
That is a very common response to requests for
That's
surgery.
interesting. I didn't know that. And do people just accept that and say, oh, okay, you got a point, doc. I'm going to go home and think about it?
Sometimes we just need to help them along a bit, like perhaps I'll recommend colleagues who have weight loss centers and help them through the weight loss program. And maybe they do body contouring at the end of weight loss, but perhaps after weight loss, they're pretty happy with their body image and they don't need to do it. Or if they're depressed, or I feel that they've had a recent breakup or a marriage that's fallen apart, plastic surgery is not what you need. You need to take a good year, just resolve the issues, be healthy psychologically before you even consider changing your appearance. So, we're pretty crafty as humans, and we tend to sublimate real issues and grab the shiny coin. And cosmetic surgery can be wonderful if done for the right reasons. It can be very bad if it's done for the wrong reasons.
Do you get people? This is the thing that occurs to me is you get people who have a procedure done and say, oh my God, that wasn't how I pictured it, and come back to you and say, my lips they look like balloons. I gotta, can you undo this? Does that happen a lot?
Reversibility is important, especially if they're uncertain what they want to achieve. So we're lucky we have a lot of, let's say, soft tissue fillers that are temporary, or we can dissolve them away. And the use of computer imaging now, 2- and 3-dimensional computer imaging, we can pretty much show a woman what it would look like after breast enhancement or after a lift, to ensure that what they see is what we're trying to interpret and achieve. So the mismatch between a patient's expectations and the surgeon's vision has gotten much better over the last decade with really, really good dimensional imaging. So I can really show a patient what I'm thinking after listening to them, so we're not, on two different planets.
All right, we're talking to Dr. Steve Mulholland, plastic surgeon. Can I say it to the stars? I mean, it just rolls off your tongue pretty.
Everybody's a star to me.
Everybody's a star to him. And I'm here with Dr. Steve Mulholland. And we're just talking plastic surgery. And by the way, if you have any questions you'd like to ask a genuine, certified plastic surgeon, if you're thinking about it or just curious about it, 416-872-1010. He's here. He's got his headphones on. He's going to answer your questions. That's 416-872-1010. Of course, you can text me 71010 and I'll read your question to him if you're shy. But it's much better if you call in, 416-872-1010. Dr. Mulholland, I wanted to ask you, what are some of the trends lately in plastic surgery or coming up for the fall and winter? Does it go in trends, or are there some evergreen things that people always want to have done? Obviously, boob jobs, nose jobs, these are the classics, but anything new in the plastic surgery world?
Yeah, those are the perennials, and there's a seasonality to some things. But what is trending is anything fast, anything low risk, anything that's non-surgical. And so we've got some really cool technology that kills localized areas of fat, things that might be diet or exercise resistant without surgery. We can cool the fat down and freeze it. That's called cool sculpting. And we can heat the fat up now and warm it gently, and that's called sculpture. So
what happens to the fat when you heat and cool it?
So in 20 minutes, we apply this energy, and these devices will shrink a centimeter or two where it might bug you. Guys, it's love handles. Women, it's usually the pot, the outer inner thigh. And just like if you think about diet, if you restrict some calories over 4 to 6 weeks, your fat cells will shrink and your liver manages the fatty discharge, and there's no heart or stroke risk. So the amount of fat broken down is then managed by your own internal pathways, and you basically poop it out and pee it out. And so non-surgical fat treatment, non-surgical liposuction, injectables. We've got a new product called in Canada called Belkyra, which we can inject into a double chin. Takes all of 5 minutes. It's actually cool. It's a little chemical called deoxycholate, which Our gallbladder releases the moment we see a McDonald's French fry, and it dissolves fats. Now we've bottled this into an injectable Goodbye Mr. Double Chin injection, and that's very popular. As we head into winter,
How much does a Goodbye Mr. Double Chin injection cost?
Well, these things are all relative. They are affordable but expensive. So in general, a double chin injection will run about $750.
That is affordable but expensive.
It is, yeah. So it's like maybe spending 6 weeks at Jenny Craig and not getting rid of your double chin. So it can actually be more effective, cost effective, than wasting money on things you've tried and just won't work.
Are you ready to take a call from Sue in Toronto?
Mm-hmm, absolutely.
All right. 416-872-1010. I've got Dr. Steve Mulholland, plastic surgeon here. If you have any plastic surgery questions, if you've been thinking about it, pondering it, musing on it, you can use a false name if you're shy. It's 416-872-1010. Let's go to Sue. Hey, Sue.
Hello.
Hello.
I wanted to ask if you've ever done anything for somebody who has periorbital dermatitis.
Well, Sue, that's a great question.
Better explain what that is.
Well, it's an inflammatory condition characterized by redness and dry skin around the eyes, upper lids and lower lids, and it can be a dermatologic curse for sure. You'd want to see a good physician or a good dermatologist that will use anti-inflammatory topical products or even lasers to get that under control, because it can be a real nightmare to get makeup on, eyeshadow. And so find a good medical dermatologist that deals with the itises, the inflammations, and the one around your eye is definitely a curse, and try and get that treated.
Yes, it is. It takes a long time, and then it comes and goes and comes somewhere else. And I didn't know if you ever dealt with that at your level, or if it's something you just have to deal with.
In general, people that have the whole family of itises, dermatitis, whether it's periorbital or seborrheic dermatitis, can be managed with the effective adjustment of topical steroids and topical steroid creams without damaging your skin. But it really needs a good relationship with you and your dermatologist. And unfortunately, it's tough to get a dermatologist in our healthcare system and see them.
I'm trying to find a really good one.
Well, I could give you some names. If you email spamedica.com, one of my gals will hook you up with me, and I'll give you some names. I wouldn't mention them on the air, but I will let you know some good ones. And then once you get a good one, boy, just don't let them go.
Okay.
Thanks,
great.
Sue. Does that answer your question?
Yeah, thank you.
Spamedica.com, okay? Here's one on the text board, Dr. Mulholland.
Mm-hmm.
I have fairly deep acne scars that mostly are called ice pick scars, and the lines between my eyes make me look angry all the time. I'm an actor, and I'm really tired of always being the bad guy. Is there any kind of tech that can help me? Thank you.
Excellent question. The heartbreak of acne. You have, let's say, adolescent acne or adult onset acne. You get rid of it, and then you've got the scars for the rest of your life. Ice pick scars are the trickiest ones because they're thin and they're deep versus the rolling hill or crater type scars. And so ice pick scars, we do have some new things that can make a difference. We've got fractional needle based treatments with radio frequency energy and different types of devices. And so I would say, yes, we can improve your acne scarring generally after several treatments in about 6 months, 30 to 50% improvement. The second problem, the angry frown line, we're really good at that. A little bit of Botox, which is a chemical protein that we inject into the muscle that causes the frown, will weaken and soften it for 6 months or more. And sometimes a little soft tissue filler or sugar gel like Juvenum or Restylane can do a great job. So you could look smoother and less angry. You could go from being the bad guy to perhaps a crown attorney or a prosecutor. Of course,
You're a plastic surgeon, not a casting agent.
It might not be as lucrative, though. Bad guys are tough to find, and they're great character roles.
I hope that answers your question, texter. Dr. Steve Mulholland has done me the honor of joining me. Thank you for coming in, Dr. Mulholland. I hope that everybody's questions have been satisfactorily answered, and I appreciate you doing that. If you want to say where they can find you.
Absolutely. www.spamedica.com.
Thank you very much for coming in. When we come back, we're going to talk to a man named Steve Burns, who's the host of a kids show, who has a really funny story about dating a Playboy playmate. I don't know if I dated a Playboy Playmate, there'd be nothing funny about it. I'd be really, really serious. But he's got a funny story. We'll talk about that when we come back. Thank you very much, Dr. Mulholland, for coming into the program. Consider yourself a friend of the show and come back anytime.
Thanks again. Bye.
Thank you.